Does your child have ADHD? Is your child happy in school and at home? Does your child learn at a similar pace to his or her peers? Is your child having difficulty getting along with other children? Does your child have difficulty listening to directions and completing tasks? Children that show difficulties in several of these areas should be checked for ADHD. ADHD is the most commonly diagnosed behavioral disorder of childhood. 1 in 20 school children are affected by ADHD. That adds up to 2 million children in the US that are diagnosed with ADHD. This is a serious problem that not only affects a child, but also the family. This short film explains what ADHD is and how it can be treated. ADHD stands for Attention Deficit Hyperactive Disorder. It is a neurobiological condition that disrupts the processing of information in the brain. Contrary to popular belief, ADHD is not caused by poor upbringing. It is a congenital disorder that requires timely treatment. Inattention, hyperactivity, disruptive behavior, and impulsivity are common in ADHD. Difficulty in school is also common. The symptoms of ADHD are especially difficult to define because it is hard to draw the line at where normal levels of inattention, hyperactivity, and impulsivity end, and clinically significant levels requiring intervention begin. The most prominent characteristics of ADHD are hyperactivity, or constant restlessness, attention problems, or difficulty concentrating, and impulsiveness, a tendency to act without thinking. Depending on the predominance of one or more of these characteristics, 3 subtypes of ADHD can be distinguished. The predominantly inattentive type has namely attention-related impediments and often comes across as unmotivated and passive. The predominantly hyperactive impulsive type, on the other hand, is often restless and reacts impulsively. Finally, many children belong to the combined type, which includes the characteristics of the first 2. These children display varying degrees of attention problems, impulsive behavior, and hyperactivity. Clearly, ADHD can take on many forms. Either way, it causes inevitable problems at home, at school, and elsewhere. Besides the basic challenges of this condition, children with ADHD often have to deal with other complications. These include learning problems, such as difficulties with reading, writing, or making calculations, behavioral problems, such as disobedience, a tendency to quarrel, and aggressive reactions. These in turn cause social problems, so it's harder for them to make friends, and emotional problems, such as depression. As a result, as teenagers, they are more likely to use drugs. No single test can diagnose a child as having ADHD. To diagnose, doctors should gather information about the child and his or her behavior and environment from the child's parents, teachers, coaches, babysitters, and other adults who know the child well. Check the school and medical records for clues to see if the child's home or school settings appear unusually stressful or disrupted. Pay close attention to the child's behavior during difficult situations. Rule out other possibilities for the symptoms. For example, certain situations, such as dramatic and sudden change, like a death in the family, events, or health conditions, may cause behaviors in a child that seem like ADHD, like depression or anxiety. In the interest of the child's development, it is best to treat ADHD in time. Fortunately, thanks to today's effective and safe medication, early treatment can ensure children with ADHD can concentrate and manage themselves better. This considerably improves the child's quality of life, both at home and at school. It is therefore important that the prescription of any medication goes hand in hand with a sound collaboration between the doctor, child, parents, and teacher. Only this combination will yield the best results of ADHD. ADHD affects not only the child with ADHD, but the whole family, including parents and other siblings. Parents can play a large role in the treatment of children with ADHD by keeping a simple daily schedule. They should give children with ADHD breaks during long tasks, such as homework assignments. Patients should promote exercise and physical activities while limiting TV watching. They can help self-esteem by encouraging activities in which the child succeeds. It is important to always give children with ADHD lots of love and support. ADHD impacts school-aged children and results in restlessness, acting impulsively, and lack of focus, which impairs their ability to learn properly. Teachers should be aware of the problems children with ADHD face and assist them in any way possible to help them develop properly. Teachers can assist students by helping with organizations by helping students keep track of assignments using organizers and planners. Students with ADHD may need additional time, instruction, or monitoring to complete tasks. In closing, for an optimal development of the child, it is vitally important that the evolution of the condition is closely monitored for several years. This is the only way to ensure that a child with ADHD has the opportunity to develop a positive self-image.